Hi, Michael Eggleston again, a therapist here down in Florida, offering a little bit of education on mental health disorders that we have. Last time we talked about bulimia nervosa. Today we're going to talk about binge eating disorder because they have very similar characteristics. Not quite the same thing, but thought we'd kind of follow up with that. This is educational. It's just to offer you some insight to something that may be going on. Again, I said before, I can diagnose myself with a lot of things I read in the DSM-5, the Diagnostic and Statistical Manual 5. But if you feel like you're suffering from something you may hear in one of these videos, reach out to a mental health professional and they may be able to help you out. All right, binge eating disorder. So, recurrent episodes of binge eating characterized by like two things, right? Eating more than you would normally eat in a period of time. So like if I'm sitting down for, at a restaurant and I'm spending an hour there, I have an appetizer, I have a salad, maybe I have a meal, maybe a little dessert, and that's okay. That's fine, and I eat that. But someone doing binge eating would eat a lot more than would normally happen during that hour period of time. Also, there's lack of control. It's like once you stop, you can't stop. You can't stop. It's just you keep eating until it's like flips a switch in you, and you just can't stop. So these episodes are associated with three or more of like the following. So eating more rapidly than normal, just kind of really going really quickly and eating it. When you're eating so much that it's discomfort. Like it really hurts to put down more food, but you still continue to eat. Eating large amounts of food when you're not hungry. Let's say you may not even be hungry at all, and you still just will go ahead and eat large amounts of foods with someone with binge eating disorder. Also, eating when alone, doing because of embarrassment, really hiding the fact that there is that you're eating this much because there's shame involved. Also, you may be feeling disgust with yourself, depressed. You may feel guilty after, just kind of not really. Yeah, you have some remorse, some guilt, some shame about this. And there, it's happened at least one time a week for 3 months. There's no recurrent compensatory behaviors like you would have with bulimia nervosa, so you're not really trying to exercise or induce vomiting or take some diuretics to kind of keep from weight gain. Again, like bulimia, there is a mild, moderate, severe, and extreme. Like a mild would be 1 to 3 times a week. Moderate would be 4 to 7 times a week. Severe would be 8 to 13, and extreme 14 plus. As someone that has this will typically hide their behavior for doing this. You may find like wrappers underneath your bed or plates of food just hidden away. They always have a negative affect, so it's like meaning that they don't look like they're happy. It happens in a lot of people. It could be happening in someone that has a normal weight, that's overweight or obese. Typically, it's more common with women than with men. Not saying it doesn't happen with men, but we've found that it's more common in women. Differentials, meaning other disorders that may be similar to it. Again, bulimia, there's bipolar disorder, and the depressive disorders, and also borderline personality disorders. We'll use that in as a coping mechanism. Typically starts in adolescence or young adulthood. Again, that's not specific. It could happen in younger ages or older ages. That's just where it's most likely found in those age ranges. Hope this was helpful. Again, if you have any questions, you feel this may be something that you're dealing with, I encourage you to reach out to a professional locally and to get the help that you need. Again, I'll hopefully see you next time, and enjoy your day.